Good afternoon. It's once again Friday, 5:30. That's right. We switched times. 5:30 in the p.m. And this, of course, is your host for the next 25 minutes of the hottest television in town. That is Chicago Cable Access, interactive television. Everybody participates. Everybody's in, nobody's out. Everybody can be a part, and we're always delighted when we get a chance to come and listen to you, our viewing and listening audience. Of course, this is a heady weekend and a great week coming up because we celebrate the life and the legacy of a super change agent, Dr. Martin Luther King Jr., and of course, it gives me the opportunity to be at home a whole week in Chicago, because whenever we have this kind of a holiday, we have what is called district work days, which means that we shut Congress down. We don't do any legislative business. Every member will go home and work in their district. Of course, if you are a senator, wherever you work in the state, you're in your district. This evening, we're going to talk about some of the most important stuff in the United States of America. According to every poll, when you ask people what they're concerned about, health care looms right up there now at the top. There used to be a time when people didn't know as much about health and health care as we now know. And people know that they should expect to live longer, that they don't have to be sick all the time and just say, well, it's the Lord's way. No, they know that there are things that each one of us can do individually to improve our health. But there are also things that we can do collectively. And we're going to be talking with a health provider this evening. We are talking with Jim Kiamos.
Yes.
Who is the Chief Operating Officer of the Family Health Network. First thing maybe we ought to do, Jim, is what in the world is the Family Health Network?
Well, Congressman Davis, first I want to thank you for having me on this evening. Appreciate the opportunity. The Family Health Network is a nonprofit government provider-sponsored health plan. What I mean by that is we are governed by hospitals. We don't have, we're not traded publicly. All the margins, all the money goes to the providers, the physicians, the hospitals, in the communities where it's needed.
So are you saying that there's no big group of investors somewhere who
Exactly.
to...
The organization was founded 18 years ago by Safety Net Hospitals in Chicago.
And Safety Net Hospitals, just so our viewers know, what are they?
Safety Net Hospitals are hospitals in areas where health care is in need and it's not necessarily met. These hospitals have difficulty making money. The reason being, not due to the quality, because many of the Safety Net Hospitals offer the highest quality based on metrics. The reason is most of their patients they give care to, many are uninsured, underinsured, or covered by Medicaid or Medicare. They don't have a lot of the folks with the very rich health plans that really are the bread and butter of a hospital.
So they serve a lot of low-income people. That is, people who either, if they can find a way to pay themselves, but in many instances, the benefits are actually paid for by Medicare or Medicaid. Is that not correct?
That's absolutely true. And prior to the Affordable Care Act, better known as Obamacare, a lot of these these facilities saw folks who had no insurance. And then they basically had to write it off as charity care, and they had difficulty making up the margins. So hence the safety net name. They fill a need or where there is a void of health care.
So now we talk a great deal about managed care. They used to just simply be called, for the most part, HMO, health maintenance organizations, which meant if you can help individuals to maintain their health, then you cut down on the overall cost of health care. Because if you can keep a person out of the hospital, then it does not cost as much to take care of them, and hopefully, eventually, ultimately, that's going to overall reduce the cost of health care for the United States of America, I would imagine.
No, that's exactly true. And HMOs or plans such of ours, we're actually a managed care community network right now, the only one in the state of Illinois, which is we've been that since 1995, and we are there are some others entering the market now, but we've never been a public insurance company. We're a managed care community network, and the focus on community is we're only in Chicago. We employ 250 people in the community, and as far as caring for the members, we take a proactive approach. We have a lot of care managers, nurses that actively assess the health of an individual we enroll in the program.
Well, let me ask you, how do you get your membership? Where do your people come from? I mean, do I just decide that I want to join up with the Family Health Network, or do I get recruited, or how do I find out about it? How does that process take place?
A lot of the enrollment of the members is done when members learn about the extra benefits and the benefits of being part of the Family Health Network. For instance, transportation. We arrange rides for our members. We schedule the rides. And one thing we found about that is compliance with care is a big issue in the community. If one of our member services representatives makes an appointment for a car to come and pick somebody up on a certain day, somebody that may think, well, I don't feel like it, it's cold out or something. First off, they won't have to wait for a bus to get there. But secondly, our member service rep will call up the individual and say, your ride is waiting to take you. And this is critical for people with some chronic ailments, whether it be asthma.
You go pick people up and bring them to the clinic or bring them to the doctor? Or...
Exactly. And many of our members, they have, kids, they may have daycare issues and such. And another added benefit of our transportation is we allow mothers or family or husbands and such to bring their children with them. Because say you got to bring one of your little kids in for a visit, but if you get 3 other little ones, that's still an issue, and you may not get the little one in for a preventive visit.
All right, so how does payment take place? I'm saying I'm a person who can qualify for the plan. Once I get enrolled, what else then do I have to do?
You actually have to do nothing. We contract with the state of Illinois.
Okay. So
effectively, our plan has no co-payments. There are no out-of-pocket costs for our membership. We basically work with the state of Illinois, get the funds from the state of Illinois, and then we work with our members. And as you referenced earlier, because I know you have a background in healthcare with Miles Square and such, the focus is on keeping the members healthy, keeping them out of the physician, obviously in the physician office, out of the hospital. We want the preventive visits. That's key. Trying to limit hospitalizations, obviously, is the end result we achieve, and that's what makes us successful.
So once I'm in, all I got to do is be healthy and go to the doctor.
Oh, exactly, and work with our nurses. We have a lot of nurses that do outreach in the community, and they work with our members. So it's not just being a member, but we want our members to be engaged.
Well, that's interesting. Yeah. Well, why don't I open up a little bit so that our callers can get in if they have a mind to do so. You can reach us at 312-738-1060. That's 312-738-1060. And before I take a call, who qualifies to be a member? Or who qualifies to join this network or be a part of this plan?
Historically, is individuals on Medicaid, TANF, Temporary Assistance to Needy Families. That is all changing with the Affordable Care Act. The eligibility threshold is going up to a higher level of the poverty level, I believe 138%. So there'll be a large number of other individuals qualifying. Additionally, one big change of the Affordable Care Act is adults without dependent age children who previously did not qualify will qualify.
So you're saying if I am let's say I'm a single fella,
Mm-hmm.
and I'm 28 years old, don't have any money, don't really have not even a big, just don't really have any money with which to pay for health care, don't have a wife, don't have any children, can I qualify?
Yes, you will be able to sign with us effective July 1st, but you are qualifying for Medicaid now. We are going to be able to sign those individuals up July 1st of this year. And that's another benefit of President Obama's Affordable Care Act. Previously, these individuals had no coverage. And those were a lot of the uninsured people without care that would put off going to a visit, instead of just go to the emergency department of a safety net hospital and put a burden on the system. So from a health policy perspective, it makes much more sense.
So, people started off calling the Affordable Care Act Obamacare, and some of us who actually were in favor of it, and I must confess that I did a tremendous amount of work on it because I served on the Ways and Means Committee at the time it was being written. And we were one of the primary committees charged with responsibilities for writing the legislation. As a matter of fact, the three committees that basically had the most to do with it were Ways and Means, Energy and Commerce, and Education, because a good part of health now is indeed education, especially health care, because if you are educated, then you know that you ought to follow the advice of your physician, do what the doctors tell you. It's kind of like Father Knows Best. We used to watch this television, but
I remember it.
Doctors they did go to school to learn what they're telling you, and so they kind of know what they're talking about. So you follow their advice and you learn how to help take care of yourself. And I think that's a responsibility that each one of us have. But let's go to the phones and see what our caller has to say. Caller, are you there?
Yes, I wanted to make the point that I think that we need to do a better job of informing the public of exactly what the Affordable Care Act is and the benefits therein, because I think the other side has managed to convince Americans that this is a bad idea, bad public policy because of its cost. Yet you can never get them to tell us as a society, what does it cost us not to have people insured? What does it cost this nation not to have almost 50 million people uninsured in terms of its productivity, GDP, gross domestic product? What does it cost us when somebody gets sick and then an employer has to hire and retrain someone new? All that can be quantified, and it has been quantified by economists. So when people tell you that the Affordable Care Act is a bad idea, I would say to you, respond to them by saying, in the Western industrialized world, where is there the hue and cry, people in the streets marching out there saying, we don't want a single-payer plan, which is something that's far more deeply rooted in terms of a coverage than the Affordable Care Act, which is innocuous compared to what the rest of the Western industrialized world has. Where are these people who are marching in the streets of Great Britain and France and Japan and Australia demanding to end single-payer? Where are they? They don't exist. So what the right is afraid of in this country is that people are going to realize that just like education, the right to vote, things like health care are going to come to be seen as they are in the rest of the civilized world as a right that human beings have. You should not have as a contingent of how much money you make. And you know that is a function of whether or not you're going to receive health care. You shouldn't have to work your entire adult life, save, have a home, only to have it all disappear because you get sick and you don't have health care. And by the way, for people who wonder why, the single largest contributing factor to bankruptcies in this country is a health care cost. So in other words, people who've done everything right in the world, they get injured, they get sick. This is what happens to them in this country. It doesn't happen to them in Great Britain. It doesn't happen to them in Germany. It happens here.
I think you're absolutely right, and I certainly agree with you. I've long felt that health care should be a right, not a privilege. And I think the Affordable Care Act moves us closer to that. And I think it's a concept that I pledge to keep working for the rest of my natural life. And I thank you for your call. Did you want to respond also, Jim?
I couldn't agree more with the caller. One point he made is about people saying they don't want a single-payer system. And if you recall during the election, the irony is people are saying, don't touch my Medicare, which is the de facto single-payer system and works out wonderfully. So I just...
Well, the good thing about lying is an old saying that if you tell a lie and tell it long enough, you'll start believing it yourself.
Right.
And some of the things that I heard relative to why individuals said that they didn't want to see the Affordable Care Act, or those of us who somewhat historians, we remember when lots of people were opposed to Medicare, and especially Medicaid,
right.
And where some health providers were opposed to Medicare and Medicaid, and they didn't want to see it. And now they're both pretty acceptable, especially Medicare, which has kept senior citizens in so many instances from being in the poorhouse. But at any rate, let's take our next caller. Caller, are you there?
Hi, this is James from Chicago.
Yes.
Asthma, I understand, is a very big chronic issue, especially in low-income communities. And I was just wondering if the Family Health Network has any special programs in asthma management.
Good question.
And I'll hang up and listen to the answer. Thank you.
Absolutely. Asthma is a big concern, also diabetes in a lot of the communities we serve. But addressing asthma in your question, we have our Asthma Care Partners program. And what we do, Congressman Davis, is we actually employ people in the community to work. We train them, put them through a training session, and have them work with the people afflicted by asthma on the triggers, the care management, do home assessments, look at the home setting. And we've had great results from this program. So this also is supplemental to obviously physician care and hospital care and outpatient care. But we've had some tremendous results. What we found is a 75% reduction in emergency department visits for people with asthma in our population, a 91% reduction in admits for asthma, hospital admissions for asthma, but even more importantly, I think touching people's lives, and this is to the previous caller, a 50% reduction in absenteeism from work and school. If someone is really afflicted by something and they just, asthma for instance, and they can't make it into work, you'd like to think employers are understanding, but reality is a lot of people lose their jobs because of it, or even students, young kids who fall back in school because they're missing a lot of days. So that program has been very successful.
Well, I'm glad to know that because I've got a grandson who suffers with asthma. And, of course, I'm a type 2 diabetic myself. And so all of these programs and activities are so helpful and so beneficial. And I am delighted that networks like the Family Health Network exist and are, in fact, around and provide these great services to people who need them. I think we've got another call. We go back to the phone. Caller, are you there?
Yes, good evening. This question is for your guest, and I don't know that he's going to be able to answer or not, but this is my problem with Obamacare in general. Why are they switching from the ICD-9 coding book to the ICD-10 coding book by October 14th of 2014? That ICD-9 coding book has been used since approximately 1978, and there's roughly 14,000 codes for the various procedures. Now, under the ICD-10 book, or by October 14th, you're going to have roughly 58,000 different codes. Now that leaves a door wide open to all kinds of pressure for people to look for codes to bill things, more time being wasted for people fighting over charges on bills. They rush ahead with this program without tweaking it. I want an explanation of that, because it's fraud that has always affected the healthcare system. Medicare fraud, people paying for medical devices, outrageous amounts of money when they could be bought for so much less. So I'd like an answer for why. And there's people who need jobs. Well, it's easier to train somebody into a job to do medical billing when there's only 14,000 codes than it is to train somebody for a coding system that's 58,000 codes. So I'll get off the line, and I'd like to hear your answer. Thank you.
Thank you.
I guess I'll take that.
Yes, go right ahead.
ICD-9s and ICD-10, just for a brief explanation, that is basically a diagnosis codes for any visit to a medical provider. ICD-9s have been in for years, as the caller mentioned. We are moving to ICD-10, which is offers much more specificity. It's not a matter of upcoding. The rest of the world uses ICD-10, and there's a few reasons why. And one of the reasons is to better track health statistics nationally and on a global level. So to catch early, even pandemics or things like that. It also is, I understand your concerns about fraud and such, but it actually will limit fraud, because it holds individuals more accountable to the specific item that an individual came in for. And it is a burden for health plans, hospitals, providers, everybody. It's where the rest of the civilized world is in medicine, and actually the United States is behind the curve on this, and they've already delayed it once in implementation. We've had multiple years of notice for this, and at Family Health Network we have a big project team working on this, and we will be ready in October.
Who came up with? Was it the Institute of Medicine or?
Believe it or not, 3M, the giant company, they're known for Post-it notes, obviously, but a lot of other things. They are them and a bunch of other smart people are the brainchilds behind this. So.
Well, there are a lot of brains working on a lot of things, and I must say that medical science has made tremendous advances since I've been involved in healthcare, and I'm amazed, because every week or so seems as though we come up with something that's a bit more effective, something new, and so I think in the end we will benefit. We've got about 40 seconds left, so you want to wrap up?
No, I just wanted to thank you for hosting me today. And as I mentioned, Family Health Network, we are in the community. We employ a lot of people in Chicago. We have grown tremendously over the past 3 years. We now have close to 90,000 members, and we look to double next year. And Congressman Davis, I believe the phone number and email.
All right, is 888-346-4968. And if you want to email them, www.fhnchicago.com. And that's how you get them. Well, it's been a pleasure. It's been good to be here and to interact. Of course, it's cold outside. Be warm. See you next week.